Rahim. Assalamu alaikum. We'll be doing a single ECG today because I don't want the video to be very long, because there are a few things that I want to tell you in this ECG as well. So we start by looking at the rhythm. We have P wave in the lead 2, so this is a sinus rhythm, and we can calculate the rate by dividing the 300 with number of boxes that are present between the two R waves, and in this case this is between 40 to 50 beats per minute. Both lead 1 and AVF are upward, so the axis is normal. Then we start looking at the PR interval and the QRS complexes, ST segment, and the T waves. They all seem to be normal in all the leads, and here also nothing significant. Apart from here, you can see that in the lead V2 you have a T wave and there is a U wave over here. And also in the lead here V3 you have a U wave, and you have a U wave over here as well. And the other thing is that this S wave is very deep in lead V2. Normally we don't get such a deep wave in the leads. So there are certain criteria by which we actually define the left ventricular hypertrophy in a patient's ECG. So if the sum of the S wave in either lead V1 or V2, whichever is longer, here it is whichever is deep. So in this case, lead V2 has a deeper S wave. The sum of the S wave with R wave either in the lead V5 or V6, whichever is taller, we add the S wave, the deepest S wave with the tallest R wave, and if the sum of these two waves is greater than 35 millimeter, this is termed to be left ventricular hypertrophy, and this is the Sokolow-Lyon criteria. There are certain other criteria by which we look into the hypertrophy of the patient, left ventricular hypertrophy in a patient's ECG. These criteria are Cornell criteria and a modified Cornell criteria. What is the Cornell criteria? The Cornell criteria says that the S wave in V3, here you can see, the S wave in V3 and the R wave in AVL, though here we cannot find a big R wave, a tall R wave, but the sum of S wave in V3 and R wave in AVL, if it's greater than 28 millimeter in men and greater than 20 millimeter in women, this is termed to be left ventricular hypertrophy. And the modified Cornell criteria is we have to examine the R wave in AVL, and if this R wave in AVL is greater than 12 mm in an ECG, this will be termed as left ventricular hypertrophy. So we have learned the Sokolow-Lyon criteria, the modified Cornell criteria, and the simple Cornell criteria. But there is a newest criteria that is used nowadays that is known as Paguro-Low-Presti criterion. But before telling you that criteria, I want to add one thing, that we should know one small box of ECG is equal to 1 millimeter, and that's how we calculate the millimeters by adding the depth and the height of the waves. Alright. Now telling you about the Paguro-Low-Presti criterion. In this, what happens that the sum of S wave in lead V4, the sum of S wave in lead V4 and with the deepest S wave in the 12 lead ECG. Where we can find the deepest S wave in this ECG? Here is the S wave. Why this is not a Q wave? Because you should know that the first downward deflection is a Q wave. The deflection that comes after the R wave, even if it's very small, this upward deflection is very small, but still it's termed as R wave. So the deflection, downward deflection that is following the upward deflection, the first upward deflection will be termed as the S wave. So what is Paguro-Low-Presti criteria? In this criteria, the sum of the S wave in V4 and the deepest S wave in the 12 lead ECG, in this case it is V2, If it's the cutoff of 2.3 millivolt is for the females and 2.8 millivolts is for the males. And I also want to add one thing over here, that this ECG may be normal. These U waves may be normal, especially in the athletes. And also, you should know that the gold standard to confirm the left ventricular hypertrophy is echocardiography. So we can suspect on an ECG, but we can confirm this on echocardiography, which is a gold standard to measure to know the left ventricular hypertrophy. And also remember that here, what is 1 millivolt in a ECG? The 1 millivolt is the 10 millimeter in an ECG. So this is basically the 2 large boxes or 10 small boxes. So here you can see that this is 1 millivolt, and if you see in this ECG and we calculate the millivolts, so this is 1 millivolt, 2 big boxes, then the 4 boxes are 2 millivolts, and there the 10, 20, 30 small boxes are 3 millivolts. So this is again both for male and female. We can see that it is greater than 2.3 millivolt for females and it is greater than 2.8 millivolts for males. So again, by the criteria Paguro-Low-Presti criteria, there is left ventricular hypertrophy in this ECG. Thank you so very much.